Protein binding and drug elimination. Drugs are molecules present in the plasma. Within the plasma there is also a large quantity of plasma proteins. Drugs and proteins can interact, allow transportation of the drug, and then dissociation. The interaction between the drug and the plasma protein is based on either hydrogen bonds, ionic bonds, or van der Waals forces. Within this equilibrium, the bound fraction and the unbound fraction is determined by multiple factors. The other functions of plasma proteins, which are non-related to pharmacokinetic effects of drugs, include transportation of lipids, immune function, oncotic function, and enzymatic function. Key proteins: albumin is the greatest binding due to the most common plasma protein. They bind acidic and neutral drugs, aspirin and penicillin. Alpha-1 glycoprotein normally binds basic drugs, lidocaine and propranolol, and beta-2 globulin binds digoxin. Factors affecting drug binding are multifactorial. For example, within the plasma, the temperature, the pH, the concentration and the number of binding sites of the plasma proteins, and specific drug factors including the drug itself, the pK, so the ionization fraction, how much that drug resembles endogenous ligands, and the lipophilicity, which increases binding. Elimination. So drug elimination is the removal of an administered drug from the body. This can be achieved by an unmetabolized or metabolized drug. There are major and minor pathways. Major pathways are urine and bile. Minor is saliva, sweat, breast milk, exhalation. Within the major pathways, the urine normally eliminates water-soluble low molecular weight agents. Factors which determine this elimination would relate to urine flow, blood flow, and the conditions within the kidney which are affected by pH. Hepatobiliary is normally excretion of large lipid-soluble agents.